Laser-assisted in situ keratomylosis by Seybold-Gonsales. LASIK is an acronym not built from any word parts, but comes from the Latin term meaning in its original position or place. Kerato is a Greek derived prefix meaning cornea, and maliosis means to shape. Some history of LASIK is keratomylosis is actually a name, and he conceived and developed it as the first stromal sculpting method to correct refractional error in 1948. With his name literally translating to sculpting of the cornea, it was later found that in further discoveries, like the development by passing a microkeratome a second time through the stromal bed, and when ultraviolet lasers were added, this all came together to make LASIK what it is today. LASIK is performed by eye doctors, known as ophthalmologists. They are physicians who are either a doctor of medicine or a doctor of osteopathy. In this surgery, the ophthalmologist uses a laser to cut a small hinged flap away from the front of the eye. Folding back the flap allows the doctor to reach the part of the cornea that needs to be reshaped. Using a programmed laser, the eye surgeon reshapes parts of the cornea. The reason why this surgery is done is to help people solve for myopia, which is nearsightedness in which the eyeball is slightly longer or the cornea curves too sharply. Also hyperopia, or farsightedness, which is when the eye is shorter than average or the cornea is too flat. Or finally, astigmatism, or when the cornea curves or flattens unevenly. A diagnostic term I used was keratometer, although I am not completely sure if this is the correct term or if it is effective, but what I could understand in an article by NIH.gov, 17 patients were used for this test for this device, before and after LASIK, to prove how effective it was. Therefore, this diagnostic would be perfect for the patients wanting to pursue it. Or they could just no longer want to wear glasses or contacts, which is the majority of people wanting to do this surgery. Medical terminology is another language. Lots of words look meaningless unless you know the breakdown. However, in this section, we don't need the breakdown. Like telling a patient who isn't familiar, this is a 5-sentence way of describing it. As a surgery procedure done on patients that want to cure a part of the eye. This part of the eye can alter the way that they see, and could cause them to only be able to see close up or far away. With numbing of the eye to start the surgery, the eye to start the surgery. The patient has to use a focal point and remain calm as the doctor operates on the open eye. This surgery opens a flap in the front of the eye and goes deep within with a laser to help reshape the part of the eye that hinders the patient's sight. This correction usually leads to no longer needing to wear glasses or contacts. Here's an informational video for anyone that wants to look in my slides. There we go. Moving forward, I would like to share my semi-fictional case study where Brad Pitt, a 46-year-old man, was having trouble seeing his fans due to his poor eyesight and overall acuity of his vision. With several flashing lights accumulating around him and so many spotlights, his vision began to deteriorate. So he took it upon himself to contact his optometrist for the best course of action. This led to the beginning of trying to go into LASIK surgery. Although it was unclear which refraction error Brad Pitt suffered from, ranging from astigmatism, hyperopia, and myopia, the surgery was set forth and the ophthalmologist took action. The surgery was successful for Mr. Pitt, and he was able to see better his interactions with fans and not have to wear any glasses on sets. Where's the... Oh, there it is. And here are the words previously used in the case and their definitions. The optometrist, not built from word parts, is a health professional who diagnoses, treats, and manages diseases and disorders of the eyes and visual processing systems. The doctor of optometry, and which in this term is an acronym for just that, the doctor of optometry. Astigmatism, not built from any word parts as well, is the lens inside the eyes that are curved, causing blurred distance. Hyperopia is farsightedness, myopia is nearsightedness. Ophthalmologist is a specialist who can treat complex diseases related to the eye, built from the word root ophthalmol, meaning eye, ologist or lologist, meaning one who studies / treats. And then LASIK, finally, which is a sixth term and obviously the surgical procedure, is an abbreviation meaning laser-assisted in-situ keratomiliosis, which is a procedure that changes the shape of the cornea, correcting the vision. And all of these words share a Greek origin except for LASIK, which has both Latin and Greek roots. And the last critical thinking question I leave you with, and my final slide, is what are 3 problems with the curvature of the cornea that this surgery helps solve? Thank you for listening.